Even if you voted, you'll learn something, so come on in.
Am I live? Am I not live?
I'm gonna mute you in a second.
I appreciate that. I never did get my water. It's fine. I never got my glass of water. I was promised.
I know. Would you like? Is that live? He said he was muting me until
Good afternoon, everybody. Welcome, and thank you so much for being here this afternoon for this really very important topic. It couldn't be more prescient than the moment we're in right now. And as you know, there are only 9 more days, or 8.5 more days until the election. So I wanted to, it is something that's going to affect all Floridian women, men, and families. And as you can see on the screen today, you will see in a minute, I guess, we are discussing Amendment 4, which is on the ballot. It is amendment to the Constitution. It was put on the ballot by over 1 million women and men who signed a petition to get it on the ballot. So it was a work of effort that really happened, and we're so pleased that it's there. Now we want to make sure that everyone understands what it means. So I also want to thank everyone here. Our panelists are wonderful to come. Thank you so much for being part of this. They've been involved back and forth with me for a few months now talking. They did a radio show on WGCU, which just aired again on NPR this morning. So they cover a multitude of topics that affect us regarding this amendment. Because these health issues are very complicated and they are very personal. And so there's a lot of confusion, there's a lot of misinformation out there. People are getting tons of misinformation. Our goal today is to bring information that will be helpful to people to make a decision about what it means to their lives, to their families' lives, to their daughters' wives, children's lives. So thank you all for being here today. We're going to have about half an hour to 40 minutes of a discussion. I've invited Rebecca Seitz from 1C Production, who is going to moderate. And at the end of that, there'll be a Q&A. And Rebecca will introduce herself, and she will introduce all of the panelists. I just want to set a few ground rules for this morning. Please, we will have a Q&A after their discussion. Please be polite, respectful. You're welcome to speak, but do not grandstand about any of the issues. Let's just have a civilized conversation. And then hopefully, by the end of today, everybody will, if you haven't voted already, you'll be very clear about what you want to do. And if you have voted already, you can at least educate those who haven't voted and who are about to still go to the polls. So thank you for coming, and I'm going to turn it to Rebecca.
All right, let's see if, I love it when the tech works. That's beautiful. Well done. Well done in the back room. Let's start with what's most important, which is not me. It is the panelists who are here today. I'm happy to tell you a little bit about myself, which I will do in a moment, but I want you to know the lens through which you are about to hear information. I think it's very valuable that when someone is giving us information, especially about a topic of life or death import, that we know the perspective from which they're coming. So if we could start with Kate, and you could tell people a little bit about you, then we'll go down the line.
Yes, thank you so much for having me. I am Kate Thompson. I am on the board and the executive committee of Floridians Protecting Freedom, which is the organization and coalition that is moving Yes on 4, this ballot measure. I work with a plethora of Florida-grown and Florida-run organizations and community members that want to see abortion access in the state of Florida and end Florida's extreme abortion ban. I also have the privilege and honor of being the Senior Director of Public Affairs at Planned Parenthood of Southwest and Central Florida, and protecting access for the 87,000 patients who need access to this care every year. In that, I work to bring the perspectives of patients, of women, of our providers, and of the 900,000 supporters that we have in the state of Florida that we work with every day.
Thank you, Kate. James?
Hello, everybody. I'm James Chillemi. Originally from the New York City metropolitan area. I heard a couple New York accents outside, so I'm sure there's some people here. I graduated from Ave Maria University with a degree in politics and matriculated to Ave Maria School of Law just down the street, where I earned my law degree in 2018, became a licensed attorney in 2019, and I am the managing partner of Coliseum Counsel, a law firm here in Naples, where we specialize in everything from estate planning, probate, criminal defense, but I focus mostly on civil litigation, and a large portion of that is civil and constitutional rights. Most notably, we handled the Ramon Nomar Perez case up in Lee County, which we were successful in suing the Lee County Sheriff's Office and Carmine Marcino.
And
Shameless plug.
And Dr. Brothers?
Hi, I'm Betsy Brothers. I'm an OBGYN. I came here from Nashville, where I did my training at Vanderbilt in 2001 and have been in private practice since 1993. I am the past department chair for the OBGYN department at NCH, and I'm the current chief medical officer at North Collier Hospital.
And I'm Rebecca Seitz. Some of you heard me share my story when I spoke here a month or so ago. I own the 1C Story Network, the audio and video portion of which is 1C Productions, Inc. But more importantly to this, I was raised in the evangelical Southern Baptist movement. My family's faith was politically activated in the late 80s. By the early 90s, my mother had settled on abortion, that would be the thing our family fought using our faith. She opened a crisis pregnancy center. It later became a medical clinic that not only provided free abortions and free ultrasound, or free abortion information and free ultrasounds, but also STI testing. That clinic is still in operation in Northwest Tennessee today. My mother retired only a couple of years ago in triumph because she had spent her entire life helping to overturn Roe with the leaders in DC. In 2017, I left the evangelical movement and announced that because my entire life was in it, both my career and my personal life. And I sought to learn new things that I wasn't told in the movement. And part of what I learned was that abortion is necessary health care. There are women who will die without it. There are women who now have died without it. There are women who lose their fertility without it. And so I had to wrestle with the idea that if I was truly going to call myself pro-life, which means to protect life and to nurture life, then I had to give access to this particular kind of medical care. And I learned that because the people on this panel were willing to talk to me about it. And you can hear that on our show, Right to Life, True Stories of Choice. It's a podcast show that's available on every major podcast platform in the world. It's also on YouTube, and it is now in the top 150 documentary podcasts in the nation out of 12,000. So I do have a few questions that I wanted us to go over here in the beginning so that we would just have a base of information from which to have our congregational discussion in about 20 minutes. That's hopefully going to happen if we all stay on task here. So if we can start with, just to set the base. So currently, the state of Florida is operating under the heartbeat law regarding abortion. So James, could you tell us, what does that law allow and not allow?
Sure. And so the Heartbeat Protection Act was known as State Bill 300. It was passed in the last legislative session in which the Heartbeat Protection Act prohibits abortion after 6 weeks gestation. A lot of people, I'm sure a lot of people up on the stage with me and a lot of people in the audience agree this is one of the most restrictive abortion bans in the country. And so that's what we're currently operating under. Yeah, I'll leave it at that.
Does it allow for any exceptions?
So good point. There are emergency rules that were passed by the Agency for Healthcare Administration, which emergency rules, when the Heartbeat Protection Act and when State Bill 300 were proposed, there was a lot of pushback on the right and what they were, and on the left, excuse me. And so what the DeSantisian agencies determined was that they needed to come out with certain exceptions, that the Heartbeat Protection Act as currently written was going to be a little bit too restrictive, and so they had to make certain concessions. Those concessions include trophoblastic tumors, they include ectopic pregnancy and the like. And so there's certain certain rules that were passed. Now those rules they no longer take effect after 60 days unless they are reinstated. And so the last time they were reinstated, I believe, was August 2nd. So those rules to continue on with the Heartbeat Protection Act, should Amendment 4 not pass, will have to be reinstated as well.
So to be clear, the exceptions that came down in the emergency orders from the state of Florida have to be renewed every 60 days. They're not a part of the heartbeat law.
Correct.
I'd like to add a little bit to that as well and really characterize this. When we're talking about SB 300 that passed, we're talking about Florida's extreme and dangerous abortion ban. When we talk about exceptions, the reality is that these are not real exceptions that work for Floridian women who need access to care. These are dangerous. We see day in and day out across the state of Florida that people who are women who have experienced sexual assault, incest, or have their lives in jeopardy, or do not have a viable pregnancy, are hitting wall after wall when they are trying to get in to receive the kind of care that they need. When we look at Ohio, it's a great example of some of the dangerous things that can happen when you have a ban like Florida's extreme abortion ban. There was a 10-year-old in Ohio who was a victim of rape, and she was unable to receive the care that she needed. This is a child who needed access to life-saving care to continue. And were she in the state of Florida, it is very probable that she would have suffered a lot of challenges to get towards any kind of access and would have suffered the same fate in Ohio, where she had to go across state lines, away from her family, away from her community, to receive really traumatic, upsetting experiences in order to get the care that she needed. I also think of in Georgia, Amanda Thurman, and right in Miami, Anya Cook, who are two really strong examples of how these exceptions are not real and don't work. Amber Thurman lost her life while doctors were deciding if she was sick enough to receive the care that she needed. Anya Cook in Miami went to the emergency room 10 times while they waited to see if she was sick enough in order to receive the care that she needed. She ended up miscarrying in a public bathroom and lost about half of her blood. These exceptions are not working in real time for women in the state of Florida, and that's the choice that we have when we look at SB 300 and ending this ban. We have the choice to end Florida's extreme abortion ban, or the choice to continue to put women in danger and in harm's way.
So in continuing to provide information about what we're operating under here in Florida under the Heartbeat Law, one of the exceptions is if the pregnancy is a result of rape and incest. I'll speak to you now as the survivor of sexual assault. That exception only comes into play if we report our rape and if we provide our police report to our doctor. Less than 5% of rape victims get justice through the court system in the United States of America. We know we're not going to get justice. We don't report it often, so placing that onus upon a patient where we've been raped and now we must go to the police and we have to relive the story while we file a complaint before we can get the care that we need, that's the reality that we're living in here in the state of Florida right now. Dr. Brothers, you probably have a few more examples of it. As an OBGYN practicing in the state of Florida, what does it look like to practice under this law?
Well, there's a couple things I want to speak to, and one of them, as we've discussed before, is what is the impact on the states with the most extreme laws? We have a lot of data now from Texas and several of the other southern states particularly. One, we have increased the number of abortions that have been performed since the overturn of Roe v. Wade. We've increased that by 11%. One of the reasons for that increase is because the people who are primarily affected by this unintended pregnancies also have limited access to contraception and good quality female care. So, for example, a lot of the Planned Parenthoods throughout the southeast part of the United States have been shuttered. They've been closed down. And so access to effective contraception is limited. 41% of the population that gets a termination of pregnancy is living below poverty. Poverty is $12,000 a year, $35 a day. So most of the abortions are for women who really have limited access to finance, limited access to contraception. And so now in these states particularly, they're forced to conceive and look for ways to manage that. The other issue is that twice the other 30% of women who seek abortion are double the poverty rate. So that's only $24,000 a year. Can you imagine in Naples living on $24,000 a year, which is about minimum wage, and then trying to care for a pregnancy, having limited access to contraception, to insurance, and all of those things. So we're dealing with a population that is desperate and basically ignored by our insurance, by our government. Those women are also the highest risk for death. In the United States, we have the highest maternal mortality rate of any industrialized country. Any country industrialized, we have the highest number of dying women. 22 women out of 100,000 pregnancies will die in this country. In states like Texas, Georgia, now Florida, all this, Louisiana, Arkansas, those states that have enacted these laws have 55 per 100,000 pregnancies. They've over doubled the number of women who have died from being pregnant. So not only have we increased our abortion rate, we've increased the maternal mortality rate. And how can this possibly be a life-saving endeavor? So if we really want to serve our community, to pass this law is imperative for the quality of life and health for our patients in Florida.
And before we get to what the amendment does, because clearly we're hearing that the heartbeat law has created incredibly dangerous problems for women, what is the penalty to a physician if they perform an abortion in this state not in accordance with the heartbeat law?
I believe it's a third-degree felony.
And what's the punishment for that?
Could be anywhere from 1 to, I believe, for something in the third-degree felony category that is nonviolent would be something, I think, 12 years.
And so when a patient shows up into the emergency room and she's having a complication, physicians are afraid. They're afraid to do the wrong thing. They're afraid that they're going to get 12 years in jail for providing life-saving care to a patient. So because of that and the confusion that it causes and the fear of going to jail, we're also having fewer physicians come to states with extreme laws. We are not being trained to take care of them because the residents in obstetrics and gynecology, the residents in emergency medicine don't want to come to a state where you could spend 12 years in jail for simply taking care of a patient.
And I think the heartbeat law actually specifies 5 years, doesn't it? It specifies 5 years in jail, it's a third-degree felony, $5,000, and of course you're going to lose your license that you're probably still in medical school debt for at that point. Let's be real. So clearly a problem has been created. Multiple problems, dangerous problems have been created by the heartbeat law. And I don't want to say that those who created that law intended or foresaw these problems. I don't want to ascribe malicious intent. I'm telling you, coming from the pro-life community, many of them, myself included, for 38 years of my life, simply didn't know that if we passed these kinds of laws, we were going to bring about harm, death, and destruction. We thought we were protecting life, and that's why it's so important that we have the freedom to speak to people like Dr. Brothers and James and Kate to get accurate information. So now that we are living under the heartbeat law, a group of people did come together and try to create a solution which we'll all be voting for. So tell us what's in that amendment, Kate, and how that came about, since, not to quote Hamilton, but you were in the room.
I wasn't in the initial room, but an incredible group of women came together as they saw that other women across our country were coming together and finding solutions in these ballot initiatives, that putting forth this to the community, by and large, communities, every single time abortion has been on the ballot, they have voted to protect it because they know that it is critical to access to care. So an incredible group of women, including a former Florida Supreme Court judge, got together and said, we need to find a solution. And they invited in Florida Planned Parenthood, Florida ACLU, and a plethora of other local organizations and lawyers and experts to come together and find what was going to be right for the state of Florida. And while the legal minds were working, we also had a question. A lot of us knew, who've been in this movement for a long time, in our heart of hearts, that Floridians, the majority of Floridians, want access to this care. They understand that politicians think about this for a moment. Doctors study this for their careers in order to be able to provide reproductive health care, and that this is a personal and complex thing to go through for a woman. Any pregnancy is personal and complex, and that politicians should not be in the room. And so we asked Floridians how they felt about Florida's extreme abortion ban. And the answer was that more than 70% of Floridians wanted to see access in the state of Florida for abortion. And that became the demand. We had to meet Floridians where they were at by giving them the option to restore access. So that is what this is. This is grown and developed and pushed forth by Floridians and the support of Florida-built organizations like Planned Parenthood in Florida, ACLU, SEIU, the many wonderful nurses in that union that are supporting this, Florida Rising, and a plethora of other organizations. But really, at the end of the day, I can look around this room and see so many instrumental faces who've been part of this movement. And so it has been a huge group effort to get this on the ballot. And what does it mean? It really does come down to a very simple choice. The reason we put this on the ballot was to end Florida's extreme abortion ban, which we've talked about the gestational age, but remember that is before most people know they're pregnant. It's before most pregnancies can be seen on an ultrasound. And the exceptions are not working for real Floridians. So that's the choice that we built when we said limit government interference and no law shall prohibit, penalize, delay, or prevent access up until viability. We know what this choice means. It's end the ban or continue to put women in dangerous situations.
So you've probably seen a few signs here around Naples about the amendment. And some of the talking points that are on those signs, I'd like us to just very briefly hit because I think we've all seen those signs, right? They're over at Vanderbilt Galleria, they're down at Pine Ridge Crossing, they're all over the place, big placards that say vote no on Amendment 4. And the reasons I found surprising because I had talked to these people and I thought, well, that doesn't jive with what I know to be true of the amendment, which again is very simple. You saw it on the screen before we got started. It's 2 sentences. It's no law shall prohibit or restrict access to abortion before viability or when necessary to protect the life of the mother. One of the things that's on those placards, let me put it that way, is that this would remove current Florida law that requires parental consent for minors to receive abortions. So let me ask the attorney in the room, does this amendment remove the requirement for parental consent?
It does not. No, as you previously indicated, it is only 2 sentences long, and not only does it not remove parental consent, it makes a concession at the end of it. The second sentence is it does not get rid of parental notification. What people are worried about is that there are going to be legal challenges to the amendment that are going to invalidate Florida Statute 390.0111, which is the current Florida parental consent statute. However, it is already enshrined in the Florida Constitution the right to parental notification. What is notification, you might ask? The Florida Constitution mandates actual notice to the parents of the minor. Actual notice means they either have to pick up the phone call and get verbal consent over the phone, or they have to have proof that the parents received notice of it. And for that reason, consent and notification, as far as I'm concerned, are nearly synonymous. And so the boogeyman in the corner of getting rid of parental consent, I just don't see it.
The other thing that those placards say are no physicians, because the amendment uses the phrase healthcare provider. We covered this on an episode of the show, but what does healthcare provider mean? Is that a clearly defined term?
It is. Healthcare provider is already defined in the Florida statutes, in the Florida Patients' Bill of Rights, which, for the long and short of it, is a physician. The only person in the state of Florida licensed to perform an abortion is a physician. Nothing in the amendment changes that.
And then the final no on 4 reason that I've seen, and of course we can get into the ones that you guys have seen when we, in just a second, get into the discussion, but the final no on 4 that I've seen is that this would allow abortion willy-nilly, no reasons, up until the day of delivery, that this would remove all restrictions on abortion whatsoever. Does this amendment remove all restrictions on abortion?
It's funny, I had a friend who said the exact same thing to me the other day, and he didn't know I was going to be on this panel, and he said, well, I'm going to vote no. They're going to allow abortions up to the point that the baby's born. And I'm not going to use his name, but I said, that is not true. And so it allows for abortion up until the point of fetal viability. Fetal viability, as we've previously discussed, is a medical term. Currently, and Dr. Brothers can tell you better than I can, currently, fetal viability is believed to be 22 to 24 weeks. Now, back in 1973, when Roe v. Wade was decided, I believe it was somewhere 36 to 39 weeks.
34 weeks, yeah.
34 weeks. And so it's pushed its way back as technology has grown. And so we're finally understanding what makes a fetus viable. And so for that reason, no, it does not allow anything after the point of fetal viability with certain exceptions.
The other issue I think that we should remember is that even when women's access to reproductive health care was not opposed, 93% of women terminated their pregnancy before 13 weeks. The remainder typically is before 20 weeks, and those are because of fetal abnormalities or maternal indications that would compromise her health. So never was it something that was performed after viability. So I don't know where this is coming from other than a scare tactic.
And lately, a financial impact statement was added to the amendment that you will see on your ballot. If you've already voted, you've seen it. If you haven't voted, you will. What's the financial impact statement, Kate? What does that mean?
Absolutely. So any citizen-driven ballot initiative, for example, Amendment 4, was the reason why we call it a citizen-led ballot initiative is because we collected 1,000 signatures from Florida voters who wanted to see this on their ballot. Sorry, 1,000. My goodness,
I
how
just
dare
went
I?
1,000? What?
Sorry, we talk in the millions here at Yes on 4. 1 million signatures were collected. They needed, it was 980,000, 980,000 some odd signatures from counties across the state of Florida, and we collected over 1 million. From citizens, and that's what creates a citizen-led ballot initiative. Others are created by our legislature that will put things forward. So when it's citizen-led, like Amendment 3 or Amendment 4, it is required by the state of Florida that the state of Florida look at the impact to its citizens. So what is the financial impact of ending Florida's abortion ban? There was an impact statement initially created back in 2023 that the Florida Supreme Court found to be confusing. It was before the abortion ban had gone into place. It was complicated for people to understand. And so the Supreme Court asked them to go back and recreate it. What happened there was an extremely upsetting experience of government influence when it comes to our democracy, let alone abortion access. Anti-abortion extremism was allowed into the room of creating the financial impact statement and took away all of the information that they had previously developed for the initial financial impact statement and started over from scratch. And in that room, we saw that intake, that they found any word that they felt would influence a Florida voter to vote no, and they put it in there. They created a fear tactic. A lot of the things that we were just talking about, they are trying to scare voters when it comes to Amendment 4. And that's what's going on. Unfortunately, what we're finding over and over again in this ballot initiative, and if anyone has questions about the multitude of lawsuits, the influence the Department of Health is trying to have, or ACA, there's a lot of conversations we can have, but what we're finding is that abortion access in the state of Florida is the litmus test for democracy in the state of Florida. And it is our job to make sure that Floridians can see the way that our government is trying to interfere in their choices because they know Floridians want this access to care. So they are trying everything they can. So when you look at your ballot and you look at that financial impact statement, what you're really looking at is a no on 4 advertisement as the second paragraph. Our amendment is the first paragraph. It's confusing when you look at it as it moves on to the second. And they have put $16 million of taxpayer funds into fighting against this as the government. But that's the irony, right? We are working to limit government interference, and as the Supreme Court and many judges in the state have said, Florida voters aren't stupid. They can see the way the government is trying to influence their access to this care, and I truly believe that the more we can make that shown, the more people will understand that, yes, indeed, they want to see Yes on 4, and they want to see us restore access to this care.
So my final question before we open the floor up to your questions, so get those ready, is for you, Dr. Brothers. If 60% of the voting public passes this amendment to the state constitution and you begin to practice under this amendment to the Constitution, would you be able to provide the care that you need to provide to your patients?
Oh, absolutely. Not only that, but they wouldn't be fearful of getting the information because they know there would be choices and options, because that's often a concern they have when they come in for their first and second prenatal visit. What can I do if there's something wrong? If my baby has a fatal or near fatal congenital anomaly, am I going to be forced to have a child on a ventilator for the first couple hours of its life before it will pass? And the answer to some of those is yes. That's what you'll be forced to do in the state of Florida. So what we are hoping to be able to do is to take care of our patients, to offer them the options that is best for them and their families without fear to our medical staff for a 5-year jail term.
If I can add one thing, I work with a lot of physicians across the state of Florida, not only at Planned Parenthood, but we had 850 Florida physicians who signed a letter supporting Amendment 4. And in there, I had the opportunity to speak with many of our emergency physicians. And what they said is never in their experience have they had to spend so much time thinking about legal implications or bringing lawyers into the room before making life-saving care decisions, that it is slowing down their access and their ability to provide care. And we're seeing this also with patients who need access to abortion care, that they are being pushed when they have a maternal health crisis or a fatal fetal abnormality to receive test after test, waiting months to get an answer as to whether or not they can receive the care that they knew months ago they were going to need. And they continue to put themselves at risk, their fetus at risk. It is a really tragic experience, and that's why it's so important. Yes, please.
Make no mistake that this does not impact people with means and money. If you have a complication, you can go to Boston. You can go to states that allow a termination of a pregnancy for any reason. This affects our families and sisters out there who don't have access. So this is the racial disparity and the financial disparity. It is affecting our most vulnerable population the most.
I'd like to open it up to the floor. I think we have somebody helping with... Oh, yay, we have an extra microphone. And we are live on social media, so I may repeat or clarify your question for our audience that's watching us online. Go ahead.
Yeah, I wanted to make everyone aware that if it has been live streamed, it is being live streamed right now on our Facebook page, the Unitarian Universalist Congregation of Greater Naples Facebook's website, Facebook Live. And in a couple days, it'll be run on YouTube. So for those of your friends who maybe haven't voted, who understand or are not clear still about this amendment, they should listen to this on YouTube and get some facts. And I want to thank the Unitarian Congregation for hosting this, and also the League of Women Voters of Florida has given us support for this. So now we'll open up to questions. Remember, no haranguing, just questions, please.
I can take it.
Oh, before I go, I have a question. I had this discussion with a family member this weekend, and he wanted to know, in the viability, are you saying viable without any ventilator or how are they mentioning viability?
So when they talk about the limits of viability, so two different issues. So one of the viability issues for the termination of pregnancy is based on the ability for a baby to survive outside the womb. So when we're talking about the limits of viability for this law, it is what is the probability that a baby could live outside the womb. So that's how that is defined for the legal purposes here. Right now, 22 weeks, maybe 10% of babies born at 22 weeks, if they are in a tertiary care center, can survive. Historically, it was, as we talked about, 34 weeks. One of the first Kennedy children with prematurity died at 34 weeks with prematurity. Now we consider that equal to term. The other question you have is viability. Is it related to if we have a child that is going to be born with complications? Correct. Is that the question? Okay. So for a child that has, for example, a significant cardiac malformation, a brain malformation, a giant hole in the brain, a brain outside of the skull, no kidney, these are the kind of issues we're talking about. They maybe have 3 chambers to the heart instead of 4 chambers to the heart. Those are historically considered incompatible with life. Now, you might have someone argue, and this has happened to us in the world of obstetrics and neonatology, well, they can live on a ventilator. I mean, they can live for a couple of weeks. And so that has been an issue that we're fighting as well, is we have families that want no care to a child, and then we have maybe a secretary in the NICU who decides, well, they're withholding care. And so there have been legal battles fought over that. So those are trickier, those are different subjects than we're talking about here, but also very important to consider.
Thank you.
Hi, my name is Daphne Woodman, and I have been receiving Jessica Valenti's Abortion Every Day Substack letter, and am properly horrified what's happening all over our country in terms of this movement. But here, as a Florida resident, I just wondered, did this movement have any power to fight the 5 things that the DeSantis government has done to advocate against this and foster the misinformation that is present.
So I think if I'm understanding correctly what you're talking about some of the legal ways that that the government has been fighting against Amendment 4. So we're talking about the Department of Health put out a cease and desist letter on an advertisement that Yes on 4 procured around Caroline. Caroline is a Florida woman who lives in Tampa who was pregnant with her second child and had a brain tumor. And she knew that if she did not receive abortion care so that she could receive radiation therapy, that she would not only lose her life, likely lose her pregnancy, but her current daughter would lose her mother. And so she chose to have the life-saving care of abortion at that time. And she speaks up about that and the importance of having that choice when we are looking at Florida's extreme abortion ban. And the Department of Health did put out a letter asking for those advertisements in Caroline's voice to be silenced in the state of Florida. And there is legal action that's happening, and Caroline's ads are up. And not only are they up, but also we've seen from the Federal Bureau of, and I don't know the official name, but the head of news stations actually responded as well and said that this is a First Amendment violation. We took legal action, and we actually had a judge who responded and said to the Florida Department of Health, this is the First Amendment, stupid. And many other choice words in the response. And that's just one example. These lawsuits are an attempt to distract us from what's really at play right now. So while we have incredible organizations in the state of Florida and nationally helping to support to make sure that they are held accountable, we are really focused on making sure that does not change the way Floridians are seeing the choice that they have in front of them. And I repeat it all the time because I think it's really important because there is so much chaos. When I look at Caroline's story and Caroline's experience and the life she is living right now bravely and openly fighting against this ban, I do not want her story next to the government trying to silence her. I want her to be able to freely talk to all of you and all of us and say exactly what she says when she speaks to that camera and to people through their TVs. This is a choice about ending Florida's extreme abortion ban or continuing to put women in danger. And that's really, at the end of the day, what we keep trying to bring it back to, even as they try to crowd us with these lawsuits.
I'm sorry, I took her mic, but I was going to spread the questions around. Here you are.
That's okay, go ahead.
Do a question.
I was just saying, with our small media company, I mean, I've been in publishing and entertainment for over 20 years now. And when the governor of your state is putting out misinformation and disinformation regarding a piece of amending our state constitution, and he's not acting in the interest of information, he's acting in the interest of persuasion, that is a very large bully pulpit for any of our media companies to try to combat that information.
It's a misuse of the office.
It is, I will say that, it is a misuse of the office.
Thank you. I'm Cheryl Nunes, and I was in on the conversation with Sherry and a member of the family, a gentleman who probably would not have voted as we voted if he were a resident of Florida. But his question was the term viability. And he just, I believe, maybe I'm wrong, but I believe that he just wanted to know if the abortion ban was changed, then what would be the cutoff point, I'll say, for abortions in the future? Because the word viability, I didn't even know what that would be. So if this amendment does not pass, and we have to do this all over again, those men and women who are unclear of what that viability date and who would determine that date, I think is very important if we have to do this again. Because quite frankly, I was surprised at his response. He just wanted to know, what that date would be, and I think that's really important if we have to do that
Well,
again.
I
Because he
just wanna-
probably he would have voted yes if it was back to the 29-week
22 weeks.
or 22 weeks. He probably would have approached it in a more positive way if he had.
So
if he
first,
knew
I
what
want
that
to,
date was.
address your question of if we do this again. It's a good question. It's a very understandable question. Florida has been the most expensive state to run a citizen-led ballot initiative in the country. It is a $109 million campaign, and that is to ensure that Florida voters can hear the choice on TV. We are a tourism state with some of the highest ad rates in the country, and this is an election year when everyone is looking for an opportunity to talk, to communicate with voters, to be on the ground, talking to them day in and day out to talk about this, right? We're the third largest population proudly in the country. There is not a path to do this again for abortion access. This is it. And so I think it's really important that we ground ourselves in the reality. Floridians have put everything we have into this fight, and this is our moment. And it is hard when people have questions about viability. And I think the biggest thing, Dr. Brothers has answered this already today a couple of times, and the reality is that that's exactly who should be answering what viability is. That is the person, for physicians are the ones who have helped the state of Florida define viability. There is a reason that it is defined in a way that we look to the years and a lot of times decades of experience that our physicians have to make that personal and complex decision with each unique pregnancy. And that is why it's really important that when we talk about questions of viability, we come back to our values, which is who is the person we trust to make that decision? Because when we say viability, we put the power in the hands of the people who have the answers, and that is the physicians.
Before you ask your question, Dr. Fico, I just want to tell you, because that is my community that's raising that question, fetal viability is a defined term. It's preying upon ignorance to say that, well, they should have said 22 weeks or 24 weeks or 27 weeks. My former community, the pro-life anti-abortion community, we would not want it to say 36 weeks, 30 weeks, 27 weeks, 26 weeks for the reason that Dr. Brothers described. It's getting better all the time as our medical technology advances. So it actually would not be in the interests of life. It wouldn't have been when the Kennedy baby died at 34 weeks. What if the law had said 34 weeks? When now fetal viability might be able to go back as far as 22 weeks because of our medical advancements. So if you're trying to act in the best interest of life, you want to think the way that the framers of the Constitution thought, which is, I know what I'm living in today, but what might I be living in tomorrow and the next day and the next day? So you want to create terms that have clear definitions. Fetal viability is a clearly defined medical and legal term, as is healthcare provider, and you want to stick to those clearly defined terms. That's what's acting in the best interest of life.
I have pardon me for having two questions. I'm Michael Finkel. I'm a retired physician. The first I'm going to direct to James. Can we put the amendment up on the screen? Now, there are words there, when necessary to protect the patient's health. And if a fetus is considered a person, can that be used as another dirty trick to stop the amendment from being enacted? And then, Dr. Brothers, there are many retired physicians here, and we all know from med school that nobody can get pregnant on the first day after their period ends. So this 6 weeks, really, when should 6 weeks be counted after the first period? After last day?
Well, to answer the first question, no. I don't believe that it would be used as a Trojan horse to try to add more restrictive means. I do believe that the amendment is carefully crafted, and I do believe it accomplishes the role and the job of what it sets out to do so. Therefore, I think, as it's written, necessary to protect the patient's health, as determined by the patient's healthcare provider, I think is one of the strongest portions of the amendment, and that's one of the reasons I think we're all here today.
Second question is about last menstrual period. So historically, we didn't have ultrasounds that could tell us when people ovulated or how far along the pregnancy was. So the best we did for centuries is to say, what was the first day of your last menstrual period? Typically, we ovulate 2 weeks later, and so the actual real age of that embryo is only 4 weeks when we do the termination. So the heartbeat develops. It's just a pulse. It's not really having blood flow through it. It is just a electrical pulse. Starts at about 6 weeks, which is 4 weeks in the embryo. So they're using that as the best dating. Of course, we can also confirm with ultrasound how big that gestation is as well.
I'm Harriet Lancaster. If Amendment 4 passes and survives legal challenges that we know will come, but we have a federal government that passes a universal abortion ban, does Amendment 4 hold? And any other states similar amendment?
That is a good question. As you probably all know, there's Amendment 3 that's also on the ballot this year, which would enshrine the right to recreational use of marijuana. As you probably also know, marijuana is federally illegal. I guess your question would depend, or the answer to your question, excuse me. I guess the answer to your question would depend on what vested interest the federal government would have and the interplay between the states and the federal government in stomping out the enshrinement of abortion rights here in Florida. So for what that means, Colorado was a perfect example of marijuana rights. The federal government didn't invade Colorado once they legalized marijuana. So I believe that the state law, even according to the Constitution, which does mention supremacy, if the federal government and states both have laws that are conflicting but about the same topic, the federal government controls. However, in practice, it doesn't seem that that's actually what's happening. So to answer your question without answering it, that's what I can give you.
There's a little bit more that I'd like to say to this as well when we think of what it would likely happen at the federal level. Likely it goes through the legislature, right? And we have seen the yo-yo effect of, in the Planned Parenthood Health Centers of Title X access from the executive level. We've seen the Hyde Amendment challenges. At the national level, unless it is a constitutional amendment, there is also the chance for this yo-yo effect of in and out, a national ban or national access to care. And at the change of who is in office, we see that change. So in the state of Florida, we have an opportunity to protect our community from a lot of that yo-yoing. If a national ban were to go into effect and the next round of politicians that were to come in were to take away that, Florida would immediately have that access again. Or Florida would immediately have that ban again, right? It is this dual choice. We have an opportunity at the state level to protect ourselves as far as possible.
Hi, I'm 90 years old, and I don't agree with you. We have a chance to turn Florida blue again. We came close this year, all over the state, and I think we can still fight.
I think you do agree with her. Also, what's your skincare routine? Just out of
I was wondering the same thing.
Dr. Brothers, do they still give amniocentesis tests?
That's fairly outdated. Right now we have genetic tests that can be done just from blood work. And so we can tell the chromosomes of the baby at 9 weeks on. We can tell the gender, if they've got Down syndrome, trisomy 13. So we can check that. Rather than doing the amniocentesis at 16 weeks, we can find out at 9, 10 weeks.
And
which still,
is there an increase in Down syndrome babies in these states with abortion laws?
I don't have access to that information. I don't have it.
Yes, I'm Bill Pettinger, and I was an intern in a New York City hospital, or actually Jersey City. It was a public hospital. And one of the greatest tragedies that I observed was women coming in with botched abortions. And they were septic, and frequently enough they would die. But It was such a horrible tragedy, and that was before Roe versus Wade. And Roe versus Wade essentially eliminated that. And so that it's interesting that it hasn't come up in the discussion. Yeah, I have a question for Dr. Brothers. If you were wording the amendment, would you today, would you change the wording of it at all?
I think it allows for the physician and the patient and the family to navigate it well. So to some degree, I like a little bit of the vagueness about it, because if we all said, okay, we've determined that the limits of viability of any possibility is 22 weeks, but that's the very, very limit. Most pregnancies between 22 and 24 weeks, most babies will not survive. And so for us to be able to play with that a little bit with the family, knowing that other things come into play, it allows that conversation to defer to the family as well with medical advice. If the baby's particularly big, particularly small, or other health concerns or anything like that. So it gives us the freedom to navigate in a generative conversation with families.
Hi, my name's Carrie Coates. I guess I'm wondering what HIPAA has to, like I have a family member here, and if she's not on my HIPAA form, the doctors are going to give her no information. I'm wondering how the government has access to personal health information. They're not on my forms. Like, how are they knowing what kind of care women are getting and what kind of life-threatening procedures or whatever they have? Like, how do they know this stuff?
The government doesn't necessarily know. I mean, that's why data in our country is difficult to achieve. So it has to come often through insurance companies or things like that, where there is, coding and all of those things. And then Planned Parenthood, I mean, there are statistics kept by the American College of OBGYN. We know how many telehealth appointments are, but your specific information isn't necessarily known as much as it is statistics and coding.
My name is Tony Fisher. I don't want to close anything out, but I do want to express on behalf of the congregation the work that you're all doing and your presence here today. Thank you so much. I've had the honor, the privilege of listening to Kate Thompson report to the Board of Trustees of Planned Parenthood over the last year. And she has been doing incredible work, and her colleagues, on behalf of this amendment and on behalf of a number of organizations, just incredible. And what I wanted to ask, Kate, if you could share a little bit of what you shared on Friday night at the board meeting about where we stand right now with this amendment.
Absolutely. Absolutely. Thank you so much, and thank you for your work. We're in a tough moment right now. There was a good question asked about what's going on with lawsuits, about government interference, not only in the choice of receiving abortion care and this extreme ban that they have implemented, but also in an attempt to confuse, to spout disinformation, and make this a challenge for voters to really decide what they want this amendment. We need every vote. I am not going to lie. This is going to be incredibly close. Disinformation is pervasive. It is important that people understand and hear from community members like yourselves what is going on. Every vote is going to count. I see Jody in the back with information right there, ready to help. Yes. Yes. That's exactly right. And frankly, I call it misinformation is a term that we've been using for a long time, and I go a step further and say disinformation. They are intentionally confusing and lying to the voters in Florida. And so we need every single person helping to get out there. We need to see more people voting early. That gives us an idea of who is going to come out on Election Day. And we have found time and time again in the state of Florida, be it about restoring voting rights or others, that Floridians come out for ballot measures and amendments such as this because they see the direct impact on their life, and it brings them out to vote. We also need people who are willing to go and be at early voting and on voting day polling locations to hand out information like that so people are going in. I was just doing it yesterday in my own county, and I had so many people come up and be like, oh my gosh, okay, yes, if I want to end the abortion ban, they were looking at my sign, I need to vote yes on 4. Okay, oh, I'm so glad you were here. It makes a huge difference when we go out and we do that. And I know it's hot in Florida right now. Wear a hat, wear sunscreen, stand in the shade. But anything that you can do from your house to make phone calls, anything that you can do to be out talking to community members, if you go to FloridiansProtectingFreedom.org, we need your help, and we have all the materials and support possible to help get there. But it really is, at this point, everybody doing a little bit of voter communication a day, whether that's within your own community and the people you know, or helping us reach out to others. It is going to take every single vote. It keeps me up, but I know we can do it because, again, right, we started at 70%, and it is only disinformation and intentional confusion that has brought us to this hairpin moment. And that is why we know that we have to keep bringing it back. This is to end Florida's abortion ban and bring the decision back to doctors, who are the professionals, and the women who are in personal and complex situations needing access to care.
So, let's take one more, maybe 2 more questions. We've also got Joyce up here with a question. Go ahead.
Hi, my name is Jane Graham. Hi, everybody. My concern is that Amendment 4 passes and the inevitable lawsuits, DeSantis regime activities ensue. Do we have the money to fight it?
That's a great question, Jane. Well, first off, I want to explain what happens. November 5th, we win that night, right? Let's just say it. We win. We have access through our amendment. First thing that needs to happen is November 19th, the votes are, I believe the term is certified. Right? That's the right term? Okay, thank you. January 7th is the day that the amendment goes into our Constitution and is part of Florida law. January 7th. Same as Inauguration Day, right? It all happens like that. But as has been said about all of these lawsuits going on, they are continuing to try to find every single way that they can to undermine this. I want to re-explain. We had a petition collection, right? I said 1.4 million petitions that we collected. Well, there are lawsuits out that just happened right now saying, even though the Supreme Court said this can go on the ballot, even though $19 million was paid to supervisors of elections to validate these petitions to say we can be on the ballot, they are now coming back up and saying, we don't think those petitions were correct. We don't think. There are lawsuits out there that could put this amendment in jeopardy. So we do need to make sure that we have the legal funds possible to continue this fight after we win. We feel very strong that no matter what, we are going to win, but we have to get there. And this is the death by 1,000 lawsuits. They are just trying to find as many ways to trip it up and to make it harder for Floridians to receive this access to care.
Joyce, you want to ask our final question? Yeah. Oh.
Okay. I'm going to address this to you, Rebecca. You have been part of the pro-life movement. These are the people that are, when Kate refers to they, it's not just the government, but yes, they are pro-life, DeSantis, and Moms for Liberty. How are we going to break through prior to Election Day? What do you see that we can do to help them understand that this is disinformation and bring enlightenment?
Well, there are a couple of things to know about my community, and that is that information is siloed, and it is siloed in the form of we're taught. If you remember when I started out this panel, I said it's really important to know the perspective and the motivation from which you are hearing information, so I wanted to introduce the panelists to you. That is a very strong teaching in evangelicalism. It's yes, take in the information, but as important, if not more important, is who is bringing you the information. Let's call into question who is giving you the information. And that's why we began the Right to Life show, because I'm from the community, and we are taught that Planned Parenthood is the great Satan. You can't listen to Planned Parenthood. You can't listen to Floridians Protecting Freedom or Yes on 4 because they have an agenda. So as true as the information is that they're putting out, it can't be viewed as true from strong evangelicals because of where it's coming from. And so that's why we did the Right to Life show, because we haven't taken $1 from Planned Parenthood. We haven't taken $1 from Yes on 4. None of the organizations that are fighting for this amendment to be passed have contributed in any way to me, my company, or this show. And that's because it was so important that there be a safe, clear place for evangelicals to receive information. With the exception of today's episode of the show, which is the final episode of the show, I have never told our viewers how to vote. I'm still not telling them on today's episode how to vote. I'm telling them how I'm voting, which will be Yes on 4. And I'm voting Yes on 4 because I've listened to the information. James is not a part of any political party in the state of Florida. He's neither a Democrat nor a Republican. It's why I had him on the show. Dr. Brothers does have a bit of a background with Planned Parenthood, and we disclosed that on the show. But that doesn't eclipse all of her medical training. These are the kinds of motivations and lexicon that you have to know to engage successfully with my former community, with evangelicals. It's an entire world and lexicon in and to itself. So I'll just say this. If you're trying to engage with an evangelical, just send them to the show. They're going to hear the words that they're accustomed to hearing. They're even going to hear from people in the community. They're going to hear from Sam Sorbo, who is on the board of Keep Florida Pro-Life. They're going to hear her respond to this amendment. And in today's episode, they're going to hear from a Southern Baptist minister on this issue, all of which is factual information that we are providing to those listeners. It's just a different world. It's just information's very siloed. And so that's what you have to be aware of, is don't argue, don't try to argue logic and rationality unless you're from a trusted source.
We should probably wrap it up. I just wanted to ask if anybody wants to say one more thing on the panel here.
I would say that most of the votes that we may influence are going to be people who just don't understand. They may think that the viability is at 39 weeks because they heard that, or they may think that the massage therapist can do the termination. And so it's not necessarily the people who are very committed to the anti-abortion. It's those people who don't understand what the amendment says.
I think we should thank this panel. Kate Thompson, James Chillemi, Betsy Brothers, Rebecca Seitz. Thank you so much for being here. Kate came all the way from St. Petersburg to be here with us today. Now go out and tell those people who don't know what they're voting for, give them some information, and thank you for coming.